Great Day Live on WHAS11 is sponsored by Dr. Black's Eye Associates.
We're here at Dr. Black's Eye Associates Jeffersonville location. We're coming up, we're going to step inside the operating room to watch a cutting-edge procedure that will change one man's life.
And should be a beautiful sunny day, but for many, every day is cloudy as a result of cataracts that obscure their vision in one or both eyes. Fortunately, a local doctor is helping to change that outlook, as Angie Fenton shows you.
We're here at Dr. Black's Eye Associates Jeffersonville location where they offer all facets of eye care, but today we're here specifically for cataract surgery. Now, Dr. Black, first of all, what is a cataract?
Cataract is a cloudiness of the lens in your eye, and it causes you to have problems seeing. Night driving, seeing scores on TV when you're watching the ball game, that sort of thing.
And what's the primary cause?
Primary cause is aging, but it can be caused by other things. Trauma, certain medications like steroids or prednisone can also cause cataracts.
Okay, now this is Mr. White. Now, Mr. White, explain right now what your vision is like, because you're about to undergo cataract surgery.
My right eye, all I can see is a blur.
Okay.
In my left eye, I can see very well, except for it's got just to have cataracts in it. But on the right eye, I cannot see.
Now, out of all of the places that you could have gone for this surgery, why did you pick Dr. Black's Eye Associates?
Well, you know, they're the pioneer. They started everything, and I have faith in them, and you only have two eyes to see, so I'm giving my two eyes to them. They're good.
Vision, I mean, that's something many of us hold very dear, and it's very precious. How do you feel right now?
I feel great. I think I'm in good hands. You know, when I come out of this, I'm going to have really good vision, and I have all the faith in the world for them.
Okay, well, thank you for letting us walk through this journey with you. Now, Dr. Pugh, when we were off air, you're talking about this. I mean, your excitement with the surgery, it's palpable.
Yeah, thanks for being here. I'm excited. I'm excited for Mr. White. You know, cataract surgery is not really news. We've been doing that for decades. But what's new and exciting is that we're going to use a laser. And patients like Mr. White they've been able to come to practices like this for the past 1 or 2 years and pick a lens that's going to allow him to see far away and up close and do things and see things without glasses, which he's not been able to do. But what's really new is now as a surgeon we have the confidence from using laser to do incisions, to improve accuracy, precision, and really even safety, and improve these things and allow this technology to catch up with the intraocular lenses that we've been putting in for the past few years. It's kind of the complete product.
Okay, well, it sounds exciting. And coming up, we're going to follow Mr. White and the doctors through the cataract surgery. Here in the operating room at Dr. Black's Eye Associates Jeffersonville location. Now, Dr. Black, Mr. White is about to undergo cataract surgery, so walk us through the procedure.
Well, the first step in cataract surgery is to bring him into the laser room where we will make the incisions for the cataract. Then we go into the operating room where the cataract is actually removed and the implant is placed in the eye.
Now, what would he be feeling right now?
It's interesting. We give patients a little sedation so that they tend to be more relaxed, and we use drops to numb the eye. And you can see right now that we are going to apply the laser with an interface that connects the laser to the eye itself, and he will feel a little bit of pressure, and that will be just about it.
How long will this last total?
The laser itself takes about a half a minute, maybe 45 seconds. It takes a couple minutes to get the laser lined up and positioned exactly where we want it, but we tell patients it'll be about 3 to 4 minutes in this room.
And that's it?
That's it.
Now, Mr. White told us that he chose Dr. Black's Eye Associates because you are the pioneer in this. In particular, I mean, you have doctors from all over the country who come here and study what you're doing so they can then go out. Why is this laser more beneficial?
Well, it's interesting. This laser has been around about 3 years. We purchased our laser 2 years ago. We kind of wanted to work the kinks out first. There's been several new software upgrades just since we've gotten this laser. So we feel that this laser offers a lot to a patient. The precision that this gives us cannot be matched at doing things by hand. It is exactly the same, exactly reproducible every time. We use it to make the incision into the eye itself and into the lens. This laser also fragments the lens so that when we break that lens up into small pieces and remove it from the eye, there's less trauma to the eye. We feel that the eyes will recover more quickly. You can see he's already finished the procedure right now, so it's very exciting for us.
Okay, and then we're going to go into the next room, and what's going to happen there because we won't see him until he's on the other side in recovery.
Right. Over the next 10 to 15 minutes, he will go into the other room. We will prep the eye, make sure it's sterile, and actually go in to remove the cataract and replace the cataract with an artificial lens. In this case, he is going to get a lens that will allow him to see both at a distance and up close. And one of the things to remember is cataract surgery is not surgery to get rid of glasses, it's surgery to get rid of cataracts. So if you want to get rid of your glasses with cataract surgery, it requires adding the technology of a laser like this, and we call that refractive cataract surgery.
Okay, fantastic. Well, coming up in our next segment, we're going to talk with Mr. White. We're here in post-op with Dr. Pugh. Now, we just had the opportunity to witness Mr. White's cataract surgery. How did it go?
Good, and thanks again for being here today. And thank you, Mr. White, for being here. You're a great patient. Everything went terrific. It's fun getting to meet people, figuring out how they've seen their whole life, and coming up with a plan to help them see the way they want to see for the rest of their life. And he picked a lens which we've been able to put in for a couple of years. We've got a lot of devices that we can use to measure the eye, but finally what's exciting is we were able to, and he chose a procedure which allowed us to use laser-assisted cataract surgery to put it all together and to ensure that he does end up with the best possible vision his eye can have.
Okay, before we talk with him, just explain where he was and where he should be.
Yeah, he probably would be a better descriptor of that than I, but I know he wouldn't really pass a driver's test out of that right eye before surgery. And it's going to be a little cloudy right now, but I expect him to read the bottom of the eye chart tomorrow morning, and he'll be able to hold most small print items in front of his face tomorrow and see that well again, which he hasn't been able to do for probably 20 years or so.
Is it exciting work for you?
Yeah, it's exciting. I really enjoy. I love everyone here who loves what they do, so it's a lot of fun.
Okay, well, that's very obvious. Now, Mr. White, we appreciate you letting us walk through the journey. How do you feel?
I feel absolutely fantastic. The nurses and the doctor are so great. I can see still a little sore, but I can see a lot better right now.
Well worth it?
Yes. Oh, well worth the money. Yes.
Okay.
Always.
Okay. Well, thank you again for letting us share.
ma'am.
I'm Angie Fenton here at Dr. Black's Eye Associates in Jeffersonville.